Welcome and thank you for visiting us at this year's ECMID Network Corner in Copenhagen. I'm Daniela Seidel from the University Hospital of Cologne. So fungal infections are on the rise. This is true for the most common, like Candida and Aspergillus related infections, but especially for the rare fungal infections that are frequently misdiagnosed or overlooked due to challenging diagnostics. Diagnosis and treatment are challenging per se, and delayed or wrong clinical management is associated with high mortality, especially in patients with disseminated disease and delayed treatment start. To get more insight into the epidemiology, clinical management, and changes over time, the FungiScope Registry has been initiated 20 years ago. So this is a university-based non-profit research study where retrospective cases of fungal infections are collected via a web-based questionnaire. We are celebrating this year our 20th anniversary, and for that reason we provided the world with a new website. So visit us at www.fungiscope.net and learn more about this study and our collaborators. If you are interested in becoming a partner in the FungiScope project, you're welcome to scan the QR code and send us an email. You will be later asked to include your clinical cases in an anonymized and retrospective format on a web-based questionnaire, which is quite comprehensive, but you might need to know that not all the information is mandatory. We are looking for the general idea of the clinical case, so demographics, risk factors, how the infection was diagnosed, and how it was treated and how the outcome was. And if available, you are very welcome to include and send us the clinical fungal isolates. So we store it here centrally in our central lab in Cologne, and we offer centralized species identification and therapeutic drug monitoring for our active collaborators. Also, in vitro susceptibility testing, if necessary, it can be offered. After you include your cases, they will be run through a central quality control process that is run by our documentalist and ID physicians, and our aim is to jointly publish the work from time to time. And FungiScope offers you a great network for potentially new collaborations. We have now currently active partners in almost 90 countries around the world, with a couple of central laboratories where you're welcome to send your isolates to if you're not allowed to send it to Germany. So FungiScope offers now a reliable data source for the analysis of risk factors and treatment strategies that eventually guide treatment recommendation. It also has or holds the possibility for case controls for clinical trials of fungal infections, and offers an established platform for a centralized data collection for our partners. So if you want to have your single center analysis, you're welcome to use the platform to include your cases and then run your own analysis on it. These are a few of our latest publications that, as you can see, cover a wide range of fungal infections, especially during COVID, of course, COVID-associated mucormycosis and aspergillosis, and just recently published by John Salman Garcia about the current state of laboratory mycology in Europe and Asia Pacific. If you have a case or a patient with an infection with an uncommon fungal pathogen that you haven't seen before and you're not familiar with, you're welcome to search the FungiQuest search engine on www.fungiquest.net to identify similar cases and to see how they were treated and what the outcome was. So this is to guide physicians when they're facing unfamiliar territory with really rare cases that are very uncommon. If you haven't run the capacity mapping in your country yet, please contact John Salman Garcia for more input. And if you can expand this to your country, this is an example. They just published this in Lancet Microbe. This is the capacity mapping for mycology and antifungal treatment in Europe. where they assessed as well, on the one hand, the availability of antifungals, also the accessibility of mycological diagnostic methods, and the frequency of different fungal infections seen in their institutions. Another ongoing study is on the suitability of galactomannan as a biomarker for response assessment in aspergillosis. And you're welcome to participate. Please drop us an email by scanning the QR code. The inclusion criteria is that you have a diagnosis, at least one positive index, sample from serum or BIL, and serial galactomannan testing throughout the treatment, where the inclusion cutoff is that you have to have at least 2 additional galactomannan testing. You're also invited to join the efforts around the candida infections, non-fungemia infections in bone, joints, intra-abdominal, in the urinary tract. Please scan this QR code to get in touch with us. This is the wonderful team in Cologne led by Oliver Connelly. On the top row are the ID physicians and myself on the right. In the second, you see the project management team and the research team. On the right, the pathologist, and in the lower row, it's our surgeon and the laboratory team that are responsible for TDM and for the biobanking of our clinical isolates. So thanks to them, thanks to all the collaborators who are already active in the FungiScope registry, and thanks to you for listening and to potentially becoming a new partner of our efforts. See you soon.